Welcome to What's Your Story. Today, you're going to be excited to hear from the guest that I have. His name is Dr. Allan Long, and I'm going to tell you just a little bit about him before I introduce you to him. And I'm going to read this because I want to be sure that I get everything right. Because even though I've known him for a long time, I don't know everything about him. After leaving the U.S. Navy, see, I didn't know he was in the Navy until today. After leaving the U.S. Navy as a hospital corpsman, Dr. Long came to Las Vegas to complete his pre-med education at UNLV. He was then accepted to the prestigious National College of Chiropractic in Lombard, Illinois. And after completing his Doctor of Chiropractic, am I saying that right?
Correct.
Chiropractic degree, he returned to Las Vegas and has practiced here ever since. While in practice, he obtained postgraduate degrees in orthopedics, in neurology, and in exercise rehabilitation. And he still works full-time helping people in our community. He is married with 2 daughters and 3 sons who have followed him into the same field. And Dr. Long has been my chiropractor for about 30 years, so I'm very honored to have you on the show today. Welcome, Dr. Long.
Well, thank you, Judy, for having me, and it's a pleasure and honor to be here.
Well, it's our pleasure. So tell us this, why did you choose the profession of chiropractic?
Initially, I was going to be a medical physician, a surgeon, and when I was introduced to chiropractic, I saw the other side of healthcare and how people could be helped with natural healthcare, and so I elected to decline, but in my current practice, I still work with those specialists on a case-by-case basis as needed, and we coordinate their care.
Yeah, I think it's important for people to realize they can coordinate traditional medicine along with chiropractic. I know I hear some people say they don't want to go to chiropractic because, you know, these people are not real doctors, but you are a real doctor and you studied a long time to get to be one. Is that not right?
Well, that is correct. It's basically the education and training is basically the same as medical school, except we don't do pharmaceuticals or surgery.
And you know what's interesting? My doctor, when I had cancer, he told me, what are they called, oncologists?
Oncologists,
He
yes.
told me that when he was in medical school, they only had about 4 hours on nutrition. So he said he didn't know about what I should eat or not eat, which I found that very interesting.
And yeah, you can't blame your normal physician because unfortunately in school they're not introduced to healthcare from a nutritional point of view. And I went with one of my friends in the first stages of lectures at UCLA, and I was a little shocked to be told in your first 2 weeks you're already taught pharmaceuticals and how to prescribe medication.
Wow.
And like you said, you get between 1 to 3 hours of
Healthcare
nutrition.
Yeah, that's amazing. So why, once you became a successful chiropractor, because what have you been doing it for how long?
42 years.
42 years, because I knew it's been at least 30, 35 years since I started going to you.
Correct.
So 42 years, that's a long time.
I'm just warming up.
You have to be successful to be there that long. So why, after years of being in this business, did you go back and continue to study things like orthopedics, neurology, exercise rehabilitation?
Because a fair part of my practice is car accidents. And being in that field, the medical legal arena, I figure I might as well prepare myself to the best of my ability to not only educate, train, and understand the mechanism of injury and treatment. And that's why I chose to do those degrees, as well as helping defend patients in the medical legal arena.
Oh, definitely. Yeah, I can understand that. You know, I know you want to share things with our audience. There were 3 exciting aspects of your practice and how they can help patients that you wanted to share today, right?
Oh yes, I'm excited about it.
So tell us about those 3 things.
The first is called digital motion x-ray. And I happen to be the only physician in Nevada to own this technology. And what it is how many times people get in car accidents and they're rear-ended and they're complaining of neck pain, muscle spasms, headaches, and nobody can figure out why they're hurting. The reason being CAT scans and MRIs cannot reveal the ligament injury to the patient's cervical spine. But in our technology, we do 2,700 moving pictures in real time, and we can see, instead of this, we see abnormal movement of those levels, and we know there's ligament damage, and those can never be returned to normal. That's the sad part. But there are a couple different therapies that can help them. One's called prolotherapy, the other's called cold laser therapy, which are non-invasive, and only occasionally does a patient with that injury need cervical intervention.
Now, what was the machine that I recently experienced?
Oh, we're going to get into that
Oh,
in a
okay.
minute.
I'm
It's
getting ahead of
okay.
you, right?
It's all
Okay,
right.
I'll wait. Yeah, because that was pretty exciting.
Oh, it is. It is.
Yeah.
So that's one thing I wanted to share with the audience is this digital motion X-ray. So if you've been in an accident and they can't figure out why you're still having ongoing neck pain, headaches, muscle spasm, you may consider this test first, because to do an MRI CAT scan is usually looking for a disc involvement.
Right.
And only about 3% of cases are actually disc involvements. A lot of attorneys, that's what they're hoping for. But this technology can really document and prove what has been injured, and then we know the proper care and treatment to follow up afterwards. And a lot of times there's a lot of time, energy, money spent that's been sort of wasteful, unfortunately. So doctors should consider this test much earlier in the patient care and treatment.
I can understand that, because the MRIs, the X-rays, they show the bones, right? But they don't show the ligaments.
They don't show it in motion,
Mm.
and that's where they miss the boat,
Yeah, yeah.
so to speak.
That's very interesting.
Oh, it's love. My poor wife and daughter had an accident years ago, and the MRIs and CAT scans were normal, and we couldn't identify why they continued to hurt. So I've been waiting for this technology a long time. So finally, after 20 years, it came out, and I'm the first here in Nevada to have it.
Oh, that's wonderful.
And I've saved a lot of patients and protecting their cases and their future care and treatment, and defending them in the legal arena.
Mm. That's important to have someone who knows what they're talking about when you have to go to
Oh,
court.
that's exciting.
Yeah,
I love helping people and defend them for the right reason. We're not making something up. You can't fake this. It's there or it's not there. But we know insurance companies do not like that.
Right.
They hate this technology because there's no way to defend it. And the good news is DMX has been proven to be what we call the gold standard in healthcare to identify these injuries. And places like Walter Reed Hospital and that, they even have it in their facilities now. So it shows you the validity and quality
Yes.
of this technology.
Right. So what is the second exciting thing we're sharing?
Second part, which also helps with these accidents, is a technique called the Cox table. The Cox table, I personally got to train under Dr. James Cox, who is a renowned neuroradiologist in our profession, worldwide renowned. He's written textbooks, lectures around the country, and he developed a technique and a table that can decompress the lumbar and cervical spine. And I'm the only one in Vegas currently to have that particular table. The previous one I used for years, but then he added to that technology the cervical spine. And because he's a radiologist, he's helped proven with Loma Linda in Chicago that this treatment can help many, many people avoid low back or neck surgery when they try to tell you, can you have such a large bulging disc or even ruptured. Many people still don't have to undergo surgery using this technique.
Wow.
And that's why I'm excited
That is
about
exciting.
that technique.
Yes.
And I've saved a lot of people from surgery. That the orthopedic surgeons, one lady, her spine was compressed so much, every level, they said had to have surgery, never had it. My wife saw her not too long ago. That's been about 15 years. She says, since your husband used that table on me, I've never had any back pain. And
Now,
every
is that
vertebra
the
was
table that you've used on me whenever I get that real?
correct.
Yeah, that's a wonderful experience.
Oh, absolutely.
Yeah.
And I was so excited to have that. And then the third to share with your audience is the one I used on you recently, and that's called Cure Wave or cold laser therapy.
This is amazing. This one is amazing. Wait till you hear.
How many people have what we call neuropathy? arthritis, degeneration, the spine, the low back, the neck, the knees, the ankles. It can, even shingles we found out can help. So by penetrating deep into the tissue, it allows the body, even down to the mitochondria level, to let bodies start repair, healing, decrease inflammation, pain, swelling, and start repair and regeneration of those areas that other technology can't do. So when I saw this technology, I said, man, I got to have it to help patients, and thank God I was able to afford it.
Well, you know, you've always really cared about people's health, and you've always encouraged people to really take care of themselves and to come in when they need it. A lot of chiropractors in our area that I've had been to prior to coming, and this is a long time ago, I don't know if they still do it, but before coming to you, I would go in and they would say, oh, you've got one leg shorter than the other, and you need these 42 treatments, and they would do this whole song and dance and then sign you up for all these long treatments. Now, you never did that. You x-rayed me when I came in, and then you said, we need this and this, and sometimes you would give me 2 or 3 weeks of something, and sometimes I'd come for shorter periods, and sometimes I'd just come in for one day, and you would adjust it, and it would quit hurting, and I would go about my way. And so I was so excited when I was in there and you had this equipment and you said, let's try this because I've been experimenting and I've learned and this is really good. And I was kind of bent over. Do you remember the day it came out? I was kind of bent over and they just put this heat on me. It just was heat, and it wasn't even on me. It was about this far from me. And the next thing I knew, I was standing up straight.
That's amazing.
I mean, and how long did it take between you did my knees and my neck and my back and couldn't have been 25 minutes.
No, it doesn't take long.
And my knee quit hurting and my neck felt better and I was standing up straight. It was amazing. It was amazing. Now, what is that? Is that heat? Is that laser? What is that?
Cold laser is a sort of a light therapy, and this particular unit I have probably is the deepest penetration of any product on the marketplace. It can go down 10 centimeters, which is pretty far, into the tissue and actually address and attack the area we're looking at and pinpoint exactly what we want to work on. And the results I've been getting are amazing. One of my recent patients, like yourself, had extreme low back sciatic pain all the way down. I mean, she's literally crying, could barely come in the office. Because it was so intense, I encouraged her to go to the doctor, get an MRI just to be safe, and get some injections, because in that intensive case, she needs some medication. But when that subsided to somewhat, she came back to the office, and in about 5 visits, she has no pain.
That's amazing.
With this light therapy.
That's amazing.
And I don't know if you know how bad shingles is. But shingles can be devastating, especially in the elderly. And you have these rash spots, breakout blisters
like
on the skin.
They're horrible.
And recently, a senior citizen in Florida found one of our colleagues to have one of these treatment units, and in 5 visits she had no pain. That's unheard of in medicine. So that's why I'm excited about what I do. When I can see results like that, people get better. I mean, it makes your day.
Yes, it does make your day. It's fascinating. But do you offer like same-day appointments? Do you offer consultations to people? If someone were new to chiropractic, would they just call you and say, "I want to come find out about you and what they do"?
Yeah,
you do?
We have same-day appointments if possible, if not the next day, which is pretty fast considering other offices may wait weeks or months, which is, hey, when I'm a patient, I want to be seen now.
Yeah, if I'm in pain, I want to get it fixed.
I want to get relief.
Yeah.
And I do give free consultations, whether it's in the office or I'll get on the phone with you and help discuss your case and tell you if I think I can help you or not.
Yeah.
And most doctors won't do that either.
No. And I have a friend that she's been in a lot of pain, and she's been going to have back surgery, and I don't know if she's had it yet or not, but she talked about it a great deal. And I said, why don't you go and see my chiropractor, because I know he could help you. And she said, no, I've been going to physical therapy, and I haven't gotten any better. What's the difference in chiropractic and physical therapy?
We're a doctor and they're not.
Oh, that makes a lot of sense.
Pretty simple.
It?
And they're good at what they do in a lot of cases, and they're good for even post-surgical patients. But in general, if you're at that stage, that usually can't prevent surgery, usually. So the odds are most people don't need surgery, but of course, surgeons aren't too happy about that. But in my own practice, I said I've saved many patients. Only a few in my whole career have ever gone to surgery. So that's going to tell you something.
Yes, it does. It does. Even my mother, when my mother was still alive, she went to you, and you used to have this wonderful man, Armando, that used to do massage in your office. And still, when you come in, if you're really tense, you get a bit of a massage before you actually work on us. I mean, you put on those, what are they called, tens,
or interferential current.
That helps. But my mother swore by Armando. She thought he was the greatest thing on earth. She had bursitis in her shoulders.
Well, it's interesting you brought that up, because he just called me from Tel Aviv, Israel today.
Oh, wow. That's amazing.
And I told him where I was going to your show, and he says, please tell Judy hello for me.
Oh, that's amazing. Now, this new piece of equipment that you have, what is the name of it?
The company is called CureWave, but it's a cold laser therapy.
A cold laser therapy. Now, that should help bursitis, right?
It can help any of those conditions. Matter of fact, the inventor, and who's done this for 20 years, he was hurt his own knee a while back, and his good friend he plays sports with is a surgeon. And he says, we're going to do meniscal repair on your knee. So he said, well, he tried his own therapy on his leg in about 3 weeks. There was nothing. There was no surgery needed. That's unbelievable.
Amazing. That really is amazing. But I can believe it, because after experiencing it the other day, and only for a brief period of time, I was in and out of there in a half hour, I saw a major difference in the way I stood, and how much better I felt, and how much better my neck felt, and how much better my knees felt, because I've had, as you know, all kinds of difficulty with my knees, and that was just an amazing experience.
I know Judy came in, she says, how will I know if this works? I said, you'll see by the time you get up. You'll see a difference.
Yeah, and I did too, didn't I? I did see a big difference. So are you into more studies? Are you going to just keep studying? I mean, I don't want to be rude to you and say you're old, but you and I are probably pretty close to the same age, and I'm old, so and you're probably younger. But, at this age, you just keep studying, and every time I'm around you, you've learned something new, or you've shown me some new piece of equipment or something. Are you going to just keep doing this forever?
Well, I'm somewhat blessed. I try to stay in shape, work out, eat healthy, and retirement's not in my vocabulary. So I'm here as long as God allows me to help people, and I'm trained to do it, so why wouldn't I do it? Exactly. I love what I do.
Exactly. Yeah, and you're good at it, too.
Thank you.
You're very good at it. You play tennis every day?
I would if I could. But at least every Saturday morning.
If you weren't so busy, right? Right. What else would you like us to know about chiropractic and about your business in particular?
Well, people need to be open-minded how great this profession is and how natural health care can help you. But these extra tools I have, the average chiropractor doesn't have them, unfortunately. I wish they did, but I treat a lot of my own colleagues too, so that's going to tell you something about the quality of care we provide when your own colleagues come see you.
Yes,
which is good. But sometimes people get a wrong impression of our profession because, one, they maybe had a bad experience, or they just hear things about other people talking. Well, if you went to a bad doctor or a bad dentist or a lawyer, you'd go to another one.
Yes,
you'd find somebody else.
Exactly.
You wouldn't just be turned off and never go again. Just need to find the right one.
That's why I don't understand people who say that. It's. I have another friend who's a chiropractor up in Wenatchee, Washington. He's a great chiropractor, and he said, people come in here all the time and they say, well, this morning I went to my real doctor. And he said, I'm a real doctor. Why do
Right.
they come in and say this to me? You know, it's not like you wouldn't go, you know, if you went to your real doctor and you didn't get well, would you go to another doctor? Yes. But he said they don't do that with chiropractic.
You might find it interesting the discrimination that exists out there, but even in the old days of our profession, a lot of those medical doctors would never send their patient, but after hours they would go themselves and never tell their patients. They would go.
Isn't that fascinating?
Oh, yeah.
I went to my first chiropractor when I was 16 years old, which was a long time ago, and I was in an accident, and my dad took me to a chiropractor, and I've just been sold on it ever since, because I've had hardly any surgeries, nothing that, I've never had a broken bone, and anything that's been dislocated, and I've had a few car wrecks. You know, I've been to the chiropractor, and they've put it back in shape, and I'm fine. So I'm pretty sold on it.
Good,
and I think people get tired of hearing me say that. You know, I have an art teacher that will not go to a chiropractor, and I keep saying to him, why won't you? He's telling me how much pain he's in, and he won't go. So why are people so stubborn?
Like I said, unfortunately, they're misled, misinformed. But I've treated those kind of patients over the years, and after they came, now they're my biggest proponents. They go, definitely go to the chiropractor. It's so good. But initially, they didn't even want to consider it.
I know. So these videos that we're going to show in just a minute, can you tell us a little bit about what they're about?
Yeah, the first one will show the digital motion X-ray and how we can help identify the ligament injuries in the cervical and extremities if need be. The next one will be the Cox table and how it can help with decompression in the low back and your cervical spine.
And I can attest to that. It really works.
And a couple testimonials, and the last one will be the cold laser therapy and some a little example of a lady in Texas who was talking on a TV program there showing the benefits of it, and a professional athlete and how it helped him with his career going to the Olympics.
Wow.
So, and there are a lot of ex Hall of Famer NFL players that have given testimonials themselves, because all the years of playing sports, you can imagine how beat up they've been.
I'm sure.
And now how this therapy is really helping them dramatically feel so much better and be active in that they couldn't be before.
That's amazing.
Oh, that's great.
Yeah. So you're going to want to stay tuned and watch these videos, because you're going to learn a lot. They really are incredible. And like I said, I've been through two of those treatments, two of those aspects of treatment, and they've both been fabulous for me. And so, you know, take a look, because especially if you have any kind of pain, you know, take a look, because this might be exactly what you're looking for. Dr. Long, thank you so much.
Thank you for having me
here.
today. I
Thank
appreciate
you.
it so much.
Will you please tell our audience how they can get in touch with you, or if they want to ask you a question, where they
Sure.
can call?
I'm at 702-382-0211. You can call anytime, even after hours and weekends. I have call forwarding to my phone so I don't miss anybody.
I'm sometimes shocked when I call and you answer the phone. You know,
'Cause
that's
I
amazing.
care
He
about
really
people.
answers his own phone.
You can hardly ever get a hold of a doctor anymore. Nobody cares, but we do. We're like family in our office, so we appreciate the opportunity to at least talk to you and help you if we can, and we're there for you. And thank you for having me.
Oh, it's been our pleasure. Thank you for being here. And thank you for joining us today. I hope this has been informative for you. I beg you, please watch the videos, because I think you're going to benefit from them. In fact, I know you're going to benefit if you decide to use some of these therapies. I've done it, and it's been fantastic for me. So join us again next week when we have another exciting guest. Thank you, Dr. Long.
Thank you, Judy. Have a good day. Hi, I'm Dr. Long. I'm the Clinic Director of Sahara Healthcare. And if you've been experiencing ongoing back and neck pain, and no one seems to find out why you're experiencing that, I'm excited to share with you I have technology known as DMX, Digital Motion X-ray, that help document and prove why you're experiencing these symptoms. It's usually known as ligamentous damage.
My name is Keith Gallagher. I've lived in Las Vegas since 1962. The 1st of October, I start my 43rd year as a lawyer. The DMX actually has been a very interesting innovation for me. There was a study done by some British orthopedists that showed that 70% of people that were injured in rear-end car crashes suffer from neck pain 15 years after they were injured. I think the most important thing about the DMX and the digital motion x-ray is that it allows a person to find out what's really wrong with them. And in the absence of that technology, they just don't know.
Unlike an MRI or a CAT scan, which is static, no motion, this particular technology allows us to do 2,700 moving pictures to help identify ligamentous injuries that no other technology can provide. And it's the only one in the state of Nevada.
Once the DMX study was done, it's like finally they knew what was wrong with me, what was wrong with my neck. That I had, my understanding was shredding of the ligaments, the muscles in my neck completely shredded apart.
It is not just any Wednesday, it's Wellness Wednesday, and healing your injuries, definitely not what it used to be. New technology, new advances are helping speed up the recovery process.
Yeah, this is incredible. Health and wellness reporter Sonia Zad live at Ozone Clinic to show us some new technology for fast healing.
Hey, you guys, good morning. I feel great. I don't know about you. This is a kind of laser therapy. The machine, by the way, is FDA cleared. It's not painful at all, and it is helping countless people recover from all kinds of injuries.
All right, lock and load, and 5.
John McDowell is hardcore, but it's part of his job.
That's good.
In addition to working as a personal trainer in Dallas, the 34-year-old is an Olympic hopeful, gearing up for the trials next summer. When you work out this hard for decades, injury is inevitable.
I had a hamstring injury at that time, and that's what I originally came for.
How you feeling?
John started incorporating CureWave laser treatments to his routine, first to heal his hamstring.
Came 5 days in a row, and I was working out by day 6.
The laser is held 10 to 16 inches away from the area of pain for 30 to 90-second increments. It stimulates the body to naturally relieve inflammation and repair damaged tissue.
The damaged tissue is attracted to that infrared light so that the skin heats up.
To keep from getting too hot, Jennifer touches the skin and relies on John to tell her when the sensation is too much to handle.
So run down your hamstrings.
This high-intensity laser therapy technology, which is relatively new, increases growth of your blood vessels, collagen fibers, and the activity of immune cells to help your body heal itself.
You're not injecting anything to the body. You're not cutting and putting stitches or anything foreign in the body. These are your body's natural healing components.
People are using this for all kinds of pain, from ankle sprains and headaches to knee problems, TMJ, rheumatoid arthritis, and sports injuries like John's muscle strain.
By week 4, I had spikes on running again. That's the fastest I've ever recovered.
Faster recovery means he can get back to training and back to those Olympic-sized goals.
I'm gonna run well, and I'll be able to run a lifetime personal best, that's for sure, and that's what I can control, so that's what I look forward to doing.
Get the laser treatment if you're pregnant. Also, they don't treat the eyes. Those are the only couple of limitations. Sessions can be 15 minutes to an hour long. 15 minutes is generally about $50, and typically you'll need 6 to 12 sessions to feel back to normal, or better than normal, as I like to say. And full disclosure, you guys, this is one of the therapies that helped me to heal my strained calf. I strained it running June 5th, and by July 3rd, I hiked that volcano in Bali. So I really wanted to share this with you guys as a way to perhaps treat your pain. I have more on this posted to my Instagram story highlights for you as well.
I'm just impressed by the glasses. Cool,
yeah, I guess you got to have the
huh?
glasses. Yeah, but what happened to the old heating pad? I guess that's kind of out the window now.
No, that's not high tech enough.
Yeah, that's not.
Good stuff. Thank you, Sonia.